Ghana has received $1 million from the Antimicrobial Resistance Multi-Partner Trust Fund of the World Health Organization to implement the National Action Plan against Antimicrobial Resistance. The plan is expected to tackle the misuse of antibiotics among human, animals and food production using the One Health approach. According to the WHO, since 2017 till date, just about 6% of activities lined up under the 5-year National Action Plan against antimicrobial resistance has been executed, while others are ongoing or not started at all. A report by Sarah Ofori.
Antimicrobial resistance is a global threat to health and development due to the widespread misuse of antibiotics in human and animal health as well as food production. Ghana's National Action Plan to tackle antimicrobial resistance over the past 5 years has been directed at improving awareness and understanding antimicrobial resistance through effective communication, education and training. It was also to strengthen the knowledge and evidence base through surveillance and research. The plan also contains strategies to reduce infection through effective sanitation, hygiene and infection prevention measures. It was further to ensure the optimum use of antibiotics in humans and animals. Stakeholders were also to develop economic case for sustainable investment to develop new medicines, diagnostic tools, vaccines and other interventions.
Ghana's antimicrobial plan has attracted several funding across the One Health base. Prominent among them is the Commonwealth funding, Fleming Fund that earmark about 2.5 million Great British pounds that focus on surveillance and Fleming Fellows. A few more of this funding are in the process, including the ICAS program.
The National Action Plan is in its 5th year of implementation, yet less than 10% of the targeted projects have been achieved and over 90% either ongoing or not started at all. In 2019, the Food and Agricultural Organization, the World Organization for Animal Health, and the World Health Organization formed a tripartite and launched the Multi-Partner Trust Fund to scale up efforts to support countries to counter the threats of antimicrobial resistance through the One Health approach. The objective is to reduce the demand for antimicrobials through infection prevention and empowering targeted groups on the risk of antimicrobial resistance. This involves intersectoral commitments, that is, the Ministry of Health, Agriculture, Fisheries and Aquaculture, as well as the environment, science, technology and innovation.
This is an initiative to mitigate the risk of AMR and contribute to the achievement of the Sustainable Development Goals with the following outcomes: reduced levels and slower development of resistance, continued ability to treat infectious diseases with effective and safe antimicrobials, reduced impact of AMR on human and animal health, the environment, and economic development for populations worldwide. This aspiration is a backbone to Ghana's National Action Plan.
Ghana is among 11 lower middle income countries to benefit from the Global Antimicrobial Resistance Multi-Partner Trust Fund. The $1 million fund will be managed equally by the tripartite. Sarah Ofori, GBC News, Accra.